Chapter 10, Disability Income Insurance and Disability Benefit Programs. The learning objectives for disability income insurance and disability benefit programs are: 1. Discuss the history of disability income insurance. 2. Describe benefits and exclusions contained in the individual and group disability income insurance. 3. Name and describe the federal disability benefit programs. 4. Differentiate between SSDI and SSI. 5. State eligibility requirements, benefits, and limitations of SSDI and SSI. And 6. Explain disability benefit programs for the disabled, active military personnel, veterans, and their dependents. 7. Name states that have state disability insurance plans. 8. State eligibility requirements, benefits, and limitations of state disability plans. 9. Explain voluntary disability insurance plans. 10. Describe topics and contents of a medical report. 11. List guidelines for federal disability claims. 12. Explain procedures for state disability claims. And 13. Recognize forms used for processing state disability plans. Disability claims. Disability income insurance does not cover costs of medical care, example, the medical expenses, but provides income only. It provides benefits under certain conditions when the insured is unable to work as a result of illness, disease, or injury. Does not provide benefits if the insured is unable to work as a result of a work-related event. History. In 1880, emergence of disability income policies for accident and illness. In the early 1900s, the first non-cancelable policy was created. Paul Revere Insurance Company introduced the first non-cancelable policy that guaranteed income and no premium increases. 1956, Congress extended the Social Security program to disabled adults over 50 years of age. 1965, the Social Security program expanded to cover workers regardless of age. Now, disability insurance is offered through private and employer-sponsored plans, and federal and state programs are available for the disabled. Disability income insurance. Individual policies usually end when the person retires or reaches a certain age. It provides specific income if disabled. The insurers paid premiums. Medical expenses not covered. Disability must not be work-related, and the insured must meet specific policy criteria. The waiting period is the time from beginning of disability to beginning of the first benefit payment. During this waiting period, the disabled individual is not eligible to receive any benefits, even though he or she is unable to work. The benefit period is the maximum span of time that benefit will be paid to the disabled party. The benefit periods can range from 1 or 2 years to life, depending on the specific policy. Benefits. Residual benefits are benefits that are paid if the disability is partial or limits the capacity to work full-time. Supplemental benefits are specific provisions that may increase payments. Supplemental benefits may include a cost of living adjustment that is factored into the policy when it is written. Some policies will distribute a portion of the premiums if the policy is maintained for over 10 years with no claims filed. Accidental death and dismemberment benefit are special clause that addresses accidents that result in death or permanent disabilities. Double indemnity policies will pay twice the face amount to beneficiaries in cases of accidental death. Types of disability. Total disability. The person can no longer perform the major duties of his or her specific occupation. Partial disability, which also means residual disability, is a person cannot perform all normal work duties. And temporary disability is a person cannot perform all normal work duties for a limited period of time. Clauses. Policies can be guaranteed renewable or non-cancelable with a waiver of premium. Under the waiver of premium, the policy pays all premiums while the employee is disabled. Exclusions are provisions written into the insurance contract denying coverage or limiting the scope of coverage under the insurance policy. Some examples could be pre-existing conditions, mental conditions, or other disabilities. States that govern the use of questions related to AIDS and HIV is in the insurance application process. The consent and notice form is needed for testing. Group. Some employers offer group insurance as an optional benefit. The contracts are between the insurer and the employer. The employer pays premiums with or without the employee contributions. The policy terminates when the employee leaves the company. Federal disability programs. The disability benefit programs. The Social Security Administration, SSA, has two different programs that pay monthly benefits to the disabled persons under the age of 65, the SSI and the SSDI. In both programs, the severe disability must be for at least 1 year. There are two types of federal retirement: the Civil Service Retirement System and the Federal Employees Retirement System. The federal employees who work in civil service fall under CSRS. This system has provisions for those who become totally disabled. This program is a combination of federal disability and Social Security disability. Both portions of the program must be applied for by the worker. The disability cannot be work-related, and 5 years of service is necessary before benefits are payable. 18 months of service is necessary under the FERS. The Armed Services Disability are individuals covered under the Armed Services Disability Program that must be members of the armed services on active duty who suffer a disability or illness. The Veterans Affairs Disability Program is that the VA is authorized by law to provide a wide range of benefits to both those who have served their country in the armed forces and those individual dependents. The Disability Determination Service, the DDS, makes the determination as to which, if any, Social Security programs may provide benefits. Social Security Disability Insurance. It's a long-term plan that provides benefits to workers and self-employed who meet eligibility criteria. Insured also may be eligible for Medicare after 24 months. It converts to retirement benefits at the age of 65. Supplemental Security Income is for a long-term disability program, provides benefits to adults and children regardless of employment history. Many persons also qualify for Medicaid, and benefits are intended for those with limited income and few other resources. Civil Service Retirement System, the CSRS, and the Federal Employees Retirement System, FERS Disability. Benefits are payable for life to individuals who qualify. The Armed Services Disability, our payments are based on years of service, base pay, and severity of disability. Benefits are payable for life if the disability occurs or is aggravated while person is on active duty. The Veterans Affairs, the VA disability, is a service-connected disability, is eligible for outpatient treatment if filed within 1 year of injury. A non-service connected disability may be eligible for same benefits if criteria are met. State disability insurance. Non-industrial disability insurance programs exist in only 5 states and Puerto Rico. Started in Rhode Island in 1944 and California in 1946. Also exists in Hawaii, New Jersey, and New York. To fund the programs, a percentage of wages is deducted from paychecks, or the employer pays the plan costs. Eligibility ceases upon retirement. Restrictions. The claim for SDI should be filed within the time limit of the state laws. There is usually a grace period of 7 or 8 days after the deadline. After the claim is approved, basic benefits become payable after the 7th day of disability. There may be conditions covered under workers' compensation that limit this restriction. Unemployment benefits beyond a specified amount, and the employer has a voluntary disability plan and does not participate in a state plan. Voluntary disability insurance is designed for persons who reside and work in states without state disability insurance programs. Local private insurance carrier arranges coverage, and if disabled, the insurers receive a fixed weekly or monthly income, usually for 6 months. If disability becomes permanent, the person may qualify to receive small payments for life. Claim submission guidelines. The disability income claims. Persons must provide a complete proof of loss to establish disability. The attending physician usually must complete portions of this form. The medical report may be attached to the form for additional explanation of disability and treatment. An independent medical examiner may have to validate the disability, especially if the condition is prolonged or circumstances are questionable. Federal disability claims. The SSA has teledictation service for physicians to dictate medical reports directly over the phone. Only data less than 1 year old are allowed. The prognosis should be based on medical findings, and the claim should include functional assessment of work-related activities. These assessments should include the ability and/or the tolerance to sit, stand, lift, bend, speak, reach up, or travel if job requires. In mental impairment, assessments may include memory, communication, and social interactions. The VA Disability Outpatient Clinic claims. The processing of claims is usually long and complicated. Consider billing VA monthly to avoid payment delays, and follow instructions on patient ID card closely. Private physicians may bill patients directly. Patient then submits claim for reimbursement. The same guidelines must be followed. And it's important to keep terminology consistent with what is shown as a diagnosis or condition on the ID card. Patient's name is used in medical bills should be exactly as shown on the ID card from the VA. State disability claims. Residents of states with disability benefits must obtain claim forms from the nearest state filing office. The physician must substantiate disability for claims to be processed. Additional forms and filings may be required if disability is prolonged. Time limits for filing must be strictly adhered to, or benefits may be denied. Patient must report any income received to the state disability insurance office because it may affect benefit allocation. State disability claims. To establish a claim for disability insurance benefits, Form DE 2501 must be completed by both the patient and the attending physician. If an extension of disability is necessary, the physician and practitioner supplementary certificate, Form DE 2525XX, must be completed by the physician. This accompanies the last check issued to the patient. The Form DE 2547 is request for additional medical information, and Form DE 2547A is a medical inquiry. And this concludes the lecture of Chapter 10, Disability Income Insurance and Disability Benefit Programs.